Welcome, everyone. Thank you for joining today's important discussion. Understanding mammograms, a key to early detection and breast health. Breast cancer is one of the most common cancers affecting women worldwide, but early detection through mammograms can save lives. Let's dive in and empower ourselves with knowledge to take charge of breast health. Before we begin, here's what we'll cover today. The role of mammograms, screening guidelines, risk factors for breast cancer, and the benefits and risks of mammography. By the end, you'll have a clear understanding of why mammograms are so vital and how to make informed decisions about your breast health. Let's get started. Breast cancer is the most common non-skin cancer and the second leading cause of cancer death among women in the U.S. The good news? Early detection through mammograms can significantly reduce the risk of dying from breast cancer. Remember, knowledge and early action are your best defenses. Thanks to advancements in screening and treatments, breast cancer mortality has significantly declined since the 1980s. Mammograms play a crucial role by detecting cancer early, often before symptoms appear. Early detection can make all the difference in survival rates and treatment outcomes. A mammogram is a specialized X-ray that takes detailed images of breast tissue. It serves two purposes: screening for breast cancer in those without symptoms, and diagnosing concerns like lumps or abnormal results. Mammograms are a powerful tool for catching cancer early when it's most treatable. Mammograms work by compressing the breast tissue to get clear images from multiple angles. This helps detect any abnormalities that might not be felt during a physical exam. It's a quick process that could save your life, one small step for long-term health. Screening recommendations vary by age. Women in their 40s may choose annual screenings, while annual mammograms are recommended for those aged 50 to 74. After 75, screenings should be based on individual health and doctor recommendations. Talk to your doctor to find the right plan for you. Let's talk about how your risk level affects the kind of screenings you might need. Screening isn't the same for everyone because people have different levels of risk for breast cancer. If your risk is low, you might follow the regular screening schedule. But if your risk is higher, like if you have a family history of breast cancer or certain gene changes, like the BRCA gene, you might need to start screenings earlier and have them more often. Doctors use special tools, like the Gale model, to figure out how high your risk is. These tools look at things like your family history, age, and other factors to estimate your chances of getting breast cancer. Based on this, your doctor can make a plan just for you. This personalized plan helps make sure you're getting the right screenings at the right time to catch any problems early. The more you know about your risk, the better prepared you'll be to take care of your health. Let's talk about what affects your risk for breast cancer. Everyone's risk is different, and knowing your risk level helps your doctor decide the best way to keep you healthy. There are some things that can increase your risk, and it's important to understand them so you can take the right steps for early detection and prevention. One thing to know is that dense breast tissue can make it harder to see cancer on a mammogram, so sometimes doctors recommend extra tests like an ultrasound or an MRI for people with dense breasts. If you've had chest radiation in the past, it could also raise your risk. Family history is another important factor. If your close relatives have had breast cancer, ovarian cancer, or even certain cancers like peritoneal cancer, it might mean you're at higher risk. There are also genetic factors. Some people inherit changes in their genes, like the BRCA1 or BRCA2 mutations, which can increase the chances of getting breast cancer. In cases like this, genetic testing or counseling may be helpful. Doctors use special tools, like the Gale model, to estimate your risk. These tools consider things like your family history, personal health history, and other factors to create a clear picture of your chances of getting breast cancer. This helps your doctor recommend the right screenings and decide if you need extra care, like starting screenings earlier or having them more often. Understanding your breast cancer risk is a powerful way to take charge of your health. The more you know about your risk, the better decisions you can make to protect yourself. Now let's talk more about understanding your breast cancer risk. Doctors group people into three main risk levels: average risk, moderate risk, and high risk. If you're at average risk, your chances of getting breast cancer are less than 15% over your lifetime. For moderate risk, it's between 15% and 20%, and for high risk, it's more than 20%. Your risk level helps guide how often and what kind of screenings you might need. For example, if you're at higher risk, you might need to start screenings earlier, have them more often, or use other tests like MRIs in addition to mammograms. Knowing your risk level is like having a map. It helps your doctor create a screening plan that's just right for you. The goal is to catch any issues early when they're easiest to treat. Taking steps to understand your risk can make a big difference in protecting your health. Now that we've talked about understanding breast cancer risk, let's dive into the key risk factors that can increase your chances of developing breast cancer. It's important to know these so you and your doctor can make the best plan to protect your health. First, having a family history of breast, ovarian, or peritoneal cancer is a major risk factor. If someone in your family, like your mother, sister, or daughter, has had one of these cancers, your chances of developing breast cancer may be higher. Sharing your family history with your doctor is an important step in understanding your risk. Next is your personal history of breast cancer or high-risk conditions, like atypical hyperplasia or lobular carcinoma in situ, LCIS. If you've had breast cancer or these specific conditions before, your risk of developing breast cancer again is higher. Another factor is genetic predisposition, such as mutations in the BRCA1 or BRCA2 genes. These gene changes are inherited and can significantly raise your chances of getting breast cancer. For those with a family history or other risk factors, genetic testing or counseling might be recommended to better understand this risk. Finally, let's talk about dense breast tissue, which is the last key risk factor. Dense breasts have more fibrous and glandular tissue than fatty tissue, which not only makes it harder to detect cancer on a mammogram, but also slightly increases your risk of developing breast cancer. If your mammogram shows dense breast tissue, your doctor may recommend additional tests, like an ultrasound or MRI, to ensure everything is checked thoroughly. Now that you know the key risk factors, let's move on to how to prepare for a mammogram. This will help you feel more comfortable and confident when it's time for your screening. Preparing for a mammogram is simple. Schedule it around your menstrual cycle for less discomfort. Avoid deodorants or lotions that can interfere with results. And share your medical history with your technician. These small steps ensure accurate results and a smoother process. Now let's go over what happens during a mammogram, so you'll know exactly what to expect. The process is quick and straightforward, and understanding it can help you feel more comfortable. When you arrive for your mammogram, you'll be taken to a private area where you'll undress from the waist up and put on a gown. This gown is designed to give you some privacy while making it easy for the technician to perform the test. Next, you'll step up to the mammogram machine. The technician will position one of your breasts on a flat surface called a plate. Another plate will come down from above and gently compress your breast for a few seconds. This compression may feel a little uncomfortable, but it's very important. It spreads the breast tissue out so the X-ray can get a clear image. The X-ray will be taken from several angles to make sure all areas of the breast are visible. After one breast is done, the process is repeated for the other breast. Each X-ray takes just a few seconds, so while the compression might feel a bit awkward, it's over very quickly. During the process, the technician will guide you through each step and make sure you're as comfortable as possible. If you feel any pain or need a moment to adjust, don't hesitate to let them know. They're there to help you. Remember, the mammogram provides invaluable information about your breast health. It's one of the best tools we have for catching problems early, and the short discomfort is worth the peace of mind it brings. Now that you know what to expect during the mammogram, let's talk about what happens after the test and how the results are reviewed. This part is just as important for keeping you informed and in charge of your health. After your mammogram, the process isn't over just yet. Once the X-rays are taken, the images are sent to a radiologist, a doctor who is trained to look for any changes or signs of concern in your breast tissue. If your results are normal, Your doctor will let you know, and you'll continue with regular screenings based on your schedule. If the radiologist sees anything unusual, don't panic. Abnormal results don't always mean cancer. It could be something harmless, like a cyst or dense tissue. If needed, your doctor may recommend additional tests, such as a repeat mammogram, an ultrasound, an MRI, or even a biopsy to take a closer look. These follow-ups help provide more information to make sure everything is okay. Remember, early detection is the goal, and these extra steps are just part of making sure you get the best care. Some women ask if they can get a mammogram if they have breast implants. Well, the good news is that you can still have a mammogram, but the process may require a little extra care. When you schedule your appointment, make sure to tell the staff you have implants. The technician will need to use special techniques to get clear images of your breast tissue. During the mammogram, the technician may gently push the implants aside to get a better view of the breast tissue behind them. They'll take extra images to ensure nothing is missed. It might take a bit more time, but it's all done to make sure the screening is as accurate as possible. Having implants shouldn't stop you from getting a mammogram. It's just a small adjustment to the process to keep your health on track. Understanding your mammogram results is an important step. If your results are normal, that's great. It means there were no signs of problems, and you can continue with regular screenings. If the results are abnormal, don't worry. This doesn't automatically mean cancer. Many times, abnormal results are caused by things like cysts, benign growths, or dense tissue. In fact, 9 out of 10 cases turn out not to be cancer. But to figure out what's going on, your doctor might recommend additional tests like a repeat mammogram, ultrasound, MRI, or a biopsy, where a small piece of tissue is examined more closely. The goal of these follow-up tests is to get a clearer picture and ensure you're healthy. Your doctor will explain every step and help you understand what's happening, so you're never left guessing. Mammograms are one of the best tools we have for catching breast cancer early, but it's important to understand both the benefits and the risks. The biggest benefit of mammograms is early detection. They can find breast cancer before you feel any symptoms, which makes treatment easier and improves survival rates. For women over 50, regular mammograms significantly reduce the risk of dying from breast cancer. On the other hand, there are some risks to be aware of. Mammograms can sometimes give false positives, where the results suggest something is wrong when there really is nothing wrong. This can cause stress and lead to extra tests. There's also a small amount of radiation exposure, but it's very low, and the benefits of early detection far outweigh this risk. Understanding these points helps you make informed choices about your health. Let's wrap up with some key takeaways. Mammograms are an essential tool for early detection of breast cancer, and early detection can save lives. Regular screenings and knowing your personal risk factors are critical steps in protecting your health. Remember, it's important to talk to your doctor about the best screening schedule for you. Whether you're at average risk or high risk, there's a plan that's right for you. Don't forget that small steps, like getting regular mammograms and understanding your risk, make a big difference for your health. Thank you so much for being here today and taking the time to learn about mammograms and breast health. Remember, mammograms are a powerful tool, and with the right information, you can take charge of your health. For more support, visit trusted websites like the American Cancer Society, cancer.org, or breastcancer.org, where you can find expert advice and helpful resources. Talk to your doctor if you have any questions or concerns. They're here to help. Also, don't forget to join us every week for live webinars through Unimed Academy's Health Masterclass. These workshops are designed to give you the tools and knowledge you need to make informed decisions about your health. If you're interested in learning more about other forms of cancer screening, check out our preventative care resources. Visit our website, www.unimedacademy.com, for even more resources and support. Together, we can stay informed, stay healthy, and take care of our breast health. Thank you again for taking the time to learn about mammograms. You're making a great choice for your health and your future.